So we put the implants in about, say, 3 months ago, and we let things heal. We have some photos of those to show you. Everything looks great. One of the first things that I do is remove our temporary, and then I use an instrument to check the implants, and I like to hear a high tinging or hollow sound, or a high tinging or a bright sound. Anything that's hollow indicates that there may be some type of problem with the implants. It's not a determining factor, it just gives us some insight. We try in a tray. In this case, because we have very little posterior, we're opposing a upper denture, so we're going to have address the bite in some way to assure that the occlusion is proper, possibly some type of bite rim or something like that. Maybe I'll do a wax bite in here to help the laboratory mount the case for the entire distance. What my assistant's done already is we have an impression of the upper denture here that was done outside of the mouth. Now we'll make our impression simple, standard crown and bridge impression. And if you come right over here, you'll see the process. She'll get started, and then the first thing I'll do is I'll put a little bit around it, and then I try to go right down into the sulcus surrounding the area, so we can try to engage some of those features of the mini implant so that it comes out properly in the impression. And then just extend it out a little bit so it doesn't droop. Sarah's already ready for me. This goes in like a standard impression. And just hold it nice and steady so there's no distortion. Okay, so we have waited about two and a half minutes here, ready to remove the impression. Comes off pretty easily. Let's see how we did. One of the things you notice is that we were able to capture not only all the square, but some of the circle here. I don't know if you can see that. That's the collar around the implant. And then this one, I was able to inject enough material to give the laboratory a really nice impression, even though that implant was quite deep. So they can see all the square. The analog will snap in properly, and they'll get a good representation of where the implant is in the mouth. There's a little distortion in the anterior here. As long as we get those incisal edges, we should be good in the occlusal surfaces. But this is all in all a really nice impression. When we need to do a bite on a case where we have a few posterior teeth, instead of creating a bite rim, I'll create a wax kind of backbone for the bite. And we just simply, about half of a sheet. There's probably a lot of ways to do this. Simply push it. See the upper end? Yeah. It's mostly the right area here that we want to preserve, so we're going to rest that right down like that. That'll be enough of a bite. I'm going to ask you to bite together, please, sir. Nice and tight. Keep going, keep going, keep going, keep going, keep going. All the way down. Great. Okay, and open. We can see that we're clear through the occlusion right there. And then I'll go back. Thin layer, bite together again. Nice and tight. Yep. And that'll represent the occlusion a little bit better than just a regular bite. Okay, and open. Try to remove it all in one piece. And then I run it under cold water right away to kind of lock everything in. That'll be a lot easier for the lab to mount something like this. run it right under cold water. Okay, the finishing touches will be, if you make a reasonable temporary that you can have to snap back in with these temp caps that 3M provides, and you're in good shape. So this should just, trying to hold the upper end. Just line everything up, snap it in. There you have it. Bite together. Here's our temporary still in place, and one of the most important things the temporary is going to do by locking it in is not necessarily providing a perfectly aesthetic solution. It's or function. We don't really necessarily want that. What we really want to do is to use it to splint the implants together through the healing process so that we have better, higher rate of success of those implants. The final restoration will be splinted together as well, just like that, and will be seated with cement in about a month, 3 weeks or so. Okay?